Combo therapy, using ultrasound and motor nerve stim at the same time.
In this video, I'm going to be showing how to do combo. Combo is where you're going to use the ultrasound head to deliver motor nerve stim plus some ultrasound waves, and you're going to need a dispersive pad or an inactive pad, and then this ultrasound head will be your active pad. So come on down to the screen. We're going to come into the combo is going to be right there. And when you get to the screen, you're going to hit edit. And you can see it says select waveform, so I'm going to choose either HiVolt, and I like to use either HiVolt or pre-mod, which is the medium frequency setting. For this one, I'm going to use the HiVolt to set up. And then you're going to set the stim up first, because with the stim you don't need to move the head. But if I did ultrasound first, then I have to move the head around for safety. There's the stim. Remember, with HiVolt you need to always hit polarity negative for Pfluger's law. The ramp is how long it takes for it to come up. The sweep means does it sweep through the different frequencies. For this case, I'm going to do it for myofascial adhesions of the trapezius, 1 to 10 cycles per second. I could have set it for a specific frequency and brought it down to 10 cycles per second. But in this case, I like that sweep that I had, so I'm going to keep that. Everything else remains the same. So after I complete this and bring up the intensity, I then will hit edit on ultrasound, and I'll go and switch everything over here. I can preset everything. I'm going to do traps. It's not really a deep muscle, but it's a big muscle, so I tend to use the frequency 1 megahertz. If I switched it to 3.3, it'd be for more superficial muscle. So I'm going to keep it 1 so you can really feel it. I'm going to keep it at a nice heat because myofascial adhesions need heat to soften the tissue. If I had switched it to 20%, that would be for pulsed ultrasound for more acute or fibroblastic activity. So let's keep it here. Go back to edit. And now you can come on over here and see what I'm going to do. A little bit of gel in this region right here. Sorry, I probably should have said the patient might be cold. I've set the dispersive pad here on the other trap, although a better location would be his low back or the front of his thigh, someplace that doesn't have much sensitivity and it doesn't tickle the patient. Though he shouldn't feel anything under his dispersive pad, but sometimes the dispersive pad size will, they will have a little contraction. So I hope I've chosen a big enough one. It should be at least 4 times the size of the ultrasound head. So the whole size of this dispersive pad is pretty big. I'm going to cover the whole area right here with the trapezius that has a trigger point. Probably going to do a little treatment on the levator while we're here. I'm sure you won't mind. When you do the combo, you have to remember when I go over certain motor points and the motor nerve stim is going, his shoulder is going to shrug, his head is going to turn, his shoulder is going to pull inward. So I have to keep in motion while his body movements are happening. So I'm going to now turn up the stim. I don't have to move the ultrasound head right now. I've spread the gel in the area that I want to treat. And you should start feeling some motor nerve stim, I hope, soon. You feeling anything yet?
Yeah, I can feel.
Okay, can you hold your thumb up right with this hand and show me when it's just enough? Like tip your thumb when it's too much. Too much? So you're okay? Oh, huh? Okay, so now I'm going to keep your thumb up there so you can give me info. So if it's too much, see how much movement I'm getting out of there? But down here I'm getting very little. So for this area right here, I'm obviously at a good contraction. It's not too bad. He still has thumbs up. He's not saying, ow, it hurts too much. But if I were doing more treatment here, I'd have to go higher intensity, but then I'd have to avoid this area because this is obviously contracting in a large amount right there. Okay, so now the next thing I'm going to do is switch over here to ultrasound, and I'm just going to keep this in an area because it doesn't matter if it doesn't move. Switch to ultrasound. At this point, you can now see watts per centimeter squared. And come on over here because I'm going to hit the start button and turn the intensity up. And when the intensity goes up, the light goes on, and now I have to move. So this next thing you're feeling for, patient, is you're checking to see if it's too hot. So I'm bringing it up. I'm at 0.7 watts per centimeter squared. I can go all the way up to 2. Tip your thumb when you start feeling some heat. It's weird, isn't it? The whole neck going crazy right there. Ooh. Nice slow frequency.
Yeah, I can feel something now.
Okay. So I've made it to the max of 2.0 watts per centimeter squared. That's the max for doing continuous ultrasound when you're in contact with the skin. Of course, he said it's too hot, then I would turn down the intensity. You don't tell him to suck it up. You can relax your arm now. I think we're good. Does this feel good?
Yeah.
You can. So what's it feel? Do you feel the heat?
I can feel the heat, I can feel the contraction.
Now, I have to watch out for that shoulder blade, so you notice I've been skipping the shoulder blade. If you do use the shoulder blade, then you have to skip fast over it. But there aren't very many big muscles, so when I'm doing combo, I try to stay on the bigger muscle points. If I go slower, he feels the warmth more. What are the contraindications of ultrasound? Don't do it to the spinal cord, so I'm sticking to one side. Don't do it to fluid-filled cavities. You risk cavitation. Don't do it over bony prominences, causes periosteal reaction. Don't do it too slowly. You burn them. Don't do it longer than 15 minutes per body area because you will risk causing a platelet aggregation or a thrombus formation. Don't do it on young, growing epiphyses. I made sure that he has grown up in these areas of his body by checking his age. And then you go for the full treatment, and so I'm just going to hit stop. At the end of the treatment, you can see a summary of what you did. It tells you what the ultrasound setting was, what the HiVolt setting was, and how long. It says 7 minutes. I actually only went to about 4 minutes. So thank you very much. Bye.